Hello, everyone. Thank you all for being here in this webinar. We may say good morning in some part of the world, good evening in others, and we hope that with us, wherever you are, you will enjoy this last episode of the increasing vaccination coverage through pharmacists. Routes and procedures, frequent concerns, and common errors. Next slide, please. So, we do know that in many countries, pharmacists are already vaccinating, but we do know that in other countries, pharmacists are still not vaccinating. So the role is heterogeneous all over the world. It's not homogeneous. Some are doing the services, others are not. Whatever you're doing, our role is to increase the service, to increase the quality. If you're not doing it, to help in implementing it. And if you are already doing the service, to help you increase the quality and enhance your service. I am Marwan Ael. I'm the chairperson of the Pharmacy Practice Department at the Lebanese International University, and I am a global lead at 50G7, which is Advancing Integrated Services, and vaccination is, of course, among the services that pharmacists are offering. Next slide, please. So, some housekeeping before we start our webinar. This webinar is being recorded and live streamed via Facebook. The recording will be available on our website, www.fip.org. You may ask questions using the question box provided. So please, whatever question you have, just send it to us in the question box. You are welcome to provide also feedback on webinars@fip.org. And if you're still not a member, please join us and be a member of FIP at the FIP website at the membership registration section. FIP would like to thank GSK for supporting this online event. And in today's program, I will start with an introduction about vaccination and the role of the pharmacist in vaccination, with a small, brief snapshot at what's being done in COVID-19 vaccination with pharmacists all over the world. We will go secondly with Professor Lisa Nissim to vaccine administration rules, frequent questions and concerns of pharmacists as vaccinators. After her presentation, we will have another presentation for Maria Mendez. For preventing both presentations, we'll be visualizing two short videos on pre-vaccination procedures and the rules of administration. Please, if you think about your questions and if you want to ask them to us, please do so while watching the videos and write your questions box. And at the end, we'll be ready. So, next slide, please. After this webinar, the participants should have a better understanding of the following topic, which is vaccine administration routes and procedures, common errors that may be committed during vaccine administrations and how to avoid them, because we do know that many patients have concerns about vaccines, and to prevent and manage the adverse reactions, including anaphylactic shock. Next slide. So, some vaccination facts. We do know that the vaccination contribution to the reduction in mortality from vaccine-preventable infections is characterized by statistical and causal. This is what epidemiology says, according to indicators of incidence, mortality, and lethality. This is a fact, no debate about that. And according to the WHO, immunization is one of modern medicine's greatest success stories. The international community has endorsed the value of vaccines and immunization to prevent and control a large number of infectious diseases. So let's think, for example, now about the COVID-19 pandemic. What are some tools to fight infectious diseases? This is what we'll be seeing in the slide. Tools are for fighting against newly emerging and re-emerging infectious diseases include, next slide please, public health infrastructures, proper use of vaccines, medications like antibiotics and antivirals, screening and testing guidelines, and scientific improvements in the diagnosis of infectious disease and related health concerns. So if you look at these 5 important pillars, we see that administering vaccination is really important. And as pharmacists, we can have this role. I do like always to go to this slide that looks at the death rate from infectious disease over 100 years between 1900 and 2000. And if you look at this number, at the slope of the decline of the death rate, we can see that whenever we had an introduction of the vaccine, the death rate used to decline. And this is really very important for us to know about how vaccines would help us in order to have better outcomes for those infectious diseases, in fighting those infectious diseases. So what is the pharmacist's role in immunization? We are educators. We provide evidence-based information and advice, and we distribute leaflets and posters. But also we are advocates and promoters. We are engaged in campaigns, multidisciplinary campaigns. We work with others also in order to show how important is vaccination. We identify and advise high-risk patient groups. And of course, we serve and advise immunization committees. We are facilitators. We manage vaccination schedules and appointments. We do take care of the storage and the supply, especially when you talk about the cold chain supply management. We administer the vaccine, and of course, we keep vaccination records. So we have a big role on vaccination. FIP has been really highly involved in vaccination over the years, but in 2020, FIP has been even engaged more and more. And FIP sent letter to ministers of health of all the member organizations about the role of the pharmacist in vaccination against COVID-19. So FIP has prepared letters for these ministers, and it was translated in many languages, and the organization used these letters as they are, or they adapted it for their specific needs. And the main message of these letters were community pharmacies and pharmacists are now at the disposal of our population and health authorities to facilitate a quick, safe, and fully professional mass vaccination strategy against COVID-19, flu, and other vaccine preventable diseases. Next slide, please. Why pharmacists? Because we're accessible, we can distribute the vaccines, we have long opening hours, our infrastructures help, we are the medicine experts, we do take care of safety and quality assurance, and of course, we are a trusted profession. So as we said, FIP has prioritized among the prioritization what the letter that I have just mentioned, but also on the next slide, we see that FIP has been like prioritizing vaccination through different programs. So this program that we are in today by increasing vaccination coverage through pharmacists, and we are ending the series today, but also with another series that culminated by signing a historical commitment by FIP and member organizations to transform vaccination globally and regionally in the Transforming Vaccination Globally and Regionally program. So in today's, what's happening in COVID-19? If you look at the world and we see today what is being done, if we look at the UK and USA, let's start by the UK. In the UK, we know that pharmacists have started in vaccination, and the government urged to use pharmacies to give vaccine. The same goes to the USA, where COVID-19 vaccines is being done by pharmacists in pharmacies. But we shouldn't forget that other countries are to follow. And among these countries, we can see that we have Australia, Ireland, Denmark, and France, and hopefully other countries will be joining very soon in order to help in this massive vaccination of COVID-19. Today, we have two speakers, and we are delighted to have them with us. We will be starting with Professor Lisa Nissen. She, Professor Lisa is head of the School of Clinical Sciences at Queensland University of Technology. She is an experienced pharmacy practitioner, researcher, and educator, having worked in hospital and community pharmacy in metropolitan and rural areas in Australia. Lisa is a strong believer in the benefits multidisciplinary healthcare teams can bring to patient care. Her focus is on improving the quality use of medicines in the wider community across the healthcare continuum, with a focus on health service development and factors that influence the prescribing of medicines. Lisa was a leader of vaccination implementation of Australia through the Queensland Pharmacist Immunization Pilot. Lisa, the floor is yours, and thank you for being with us.
Thank you very much, Marwan, and thank you everybody for having me here this evening in the last of the series and the third that I've been able to participate in. And it's an exciting time for pharmacy to be involved in vaccination, and welcome to colleagues from around the world, and a great acknowledgement to those who are already vaccinating against COVID in countries internationally. So my presentation for today is really to talk about, as you can see from the title, some of the frequently asked questions and concerns pharmacists really have had in some of our experience coming into the role as vaccination providers. And I acknowledge that there's people that are on the webinar today that are from countries that have provided vaccination for decades. And there's also people that are in countries that are looking to be providers of vaccination services or are emerging providers of vaccination. So this is coming from a country that's fairly new to providing vaccination, but I think that some of these questions and concerns that pharmacists raise are probably universal across that whole spectrum, and probably at each end of those, the experienced sort of providers and even those that are coming into the space around providing COVID vaccination now as a new vaccination for all of us, and those that want to look at emerging roles as vaccinations might find some of these useful. And as we move into Maria's presentation, it'll talk more about some of the administration and errors. Some of these will be sort of investigated in more detail. So hopefully this will be useful for you. Next slide, please. So what I've really done is tried to break it into three areas, really looking at things around the vaccine, the patient, and things around the technique. And each of those are interweaving, but there's things individually about each of those that have popped up for discussion and consideration as we've gone through the introduction and the delivery of vaccination in pharmacy practice in Australia and from our experience. So I wanted to sort of walk through a few things from each of those, and hopefully you'll be able to take away through a few pointers from those. Next slide, please. So the first is really around the area of training. And I think that universally, this is something that comes up whenever we talk about introducing a new scope or a new practice or service for pharmacy. There's often questions about whether we have the competence or the capability to do the type of training that we're saying that we want to be able to do. But never more so, I think, in my professional experience, has this come with vaccination. And there's probably a number of reasons why that has been. And generally what has been involved in putting together the training and the things around training has been that it's been robust, that it's very relevant to pharmacists and pharmacy, and that it's very defensible in the eyes of our other clinical providers. And I think that it's really important for us to be thinking about that, particularly when we're looking to provide our training, not only for qualified pharmacists, but as we've had to look at in Australia, people that are now training pharmacy students and pre-registration pharmacists. So people that are coming out of university before they become registered to become pharmacists, as well as those that are already qualified. So we really want to have training that provides somebody who is very clinically able in the eyes of other practitioners who are already trained to deliver vaccinations in the community. And I think now that we're talking about delivering vaccinations like the COVID vaccination, and we look at other countries that are using their technicians. So in America, and we know that in the UK, they're looking at using technicians as well. We need to have a defensible and robust training. So that's included training, and we had ASCIA, which is a training which is around the Society of Immunology delivers it around anaphylaxis training. So what do you do when somebody has an allergic response? Making sure people have first aid training, making sure that people know all the things that you need to know around infection control, assessing patients, injection techniques, all the things that haven't classically been part of our normal pharmacy training. So we understand that pharmacists understand vaccines. We know that pharmacists know cold chains. We know that pharmacists know things about immunology. We know things about diseases, but it's been very much putting those together as a package about managing a patient and vaccination that is the important part about a robust and defensible training, and being able to do that on a continuum from students right through to registered practitioners. So I think that's been a concern from people looking outside at pharmacists, saying, have you got the skills and competencies to physically do vaccination and put that package together in a way that gives us confidence that you can manage a patient who's being vaccinated. Next slide, please. And I think part of that and the training package and the part about training comes down to this sort of, and we used to joke about it a little bit in Australia anyway, is that there's no touching in pharmacy. And there's often this feeling that people go into pharmacy because they don't want to necessarily do all of the physicality that's often associated with other clinical disciplines like medicine, like nursing, like physiotherapy, like dentistry, like podiatry, where there's a lot more touching, a lot more clinical touching of patients. And that maybe in pharmacy we aren't as tasked with that, and maybe in some of our older and more traditional training, we aren't as physically in touch with our patients, and people aren't as confident to be touching patients and feeling confident to have the contact with patients that they might need to have when they are vaccinating. And as you can see in this picture, you need to feel confident that you can have contact with a patient and be in that more intimate clinical situation with patients that you would need to have with vaccination. And it really feels like a change in perhaps the nature of the interaction that you're having with patients that you might normally be having in the clinical interaction that you have in a hospital, in an outpatient clinic, or maybe in your community pharmacy setting, even if you are doing minor ailment and triaging and over-the-counter consultations. And it's a different type of clinical activity. It's different even to taking people's blood pressure, point of care testing, and other types of interactions. And there's a need for clear communication on what is happening during the vaccination. You're about to come at somebody with a sharp object, and not everybody likes needles. People have needle fears, needle phobias. You're about to stab them with something sharp. And the patient needs to feel confident about our actions. And as pharmacists, if we are not necessarily comfortable about the whole touching thing, then maybe for some people there are concerns about how they are going to go in being part of this role as vaccinators. And we found that people have had some reluctance about undertaking the training because they don't necessarily feel confident about moving a different type of role. But in contrast, you can see in the quote underneath, people feel that they are finally using the clinical skills that they've been trained for. And they really feel that it's a very rewarding part of their role in pharmacy now, and they're making a much broader contribution. And certainly they're looking forward to things like giving the COVID vaccination and being part of that rollout. So I think it's a really important thing to consider, that it is a shift in our interaction with patients, and that need for clear communication about what we're doing and the touching and the interaction with patients and the type of role that we're playing needs to be very clear. Next slide, please. Another part of the interaction with the patient and how that plays out, I guess, with the training and our interaction with the patient is feeling confident about the discussions around vaccine hesitancy. And this is another thing that's played out for us around the concerns and the questions that have come from pharmacists. And while we, again, as health professionals, often very informed about, as we heard in the introduction, the benefits of vaccination as an intervention medically for diseases and the benefits that vaccination provides for the community, vaccine hesitancy itself is one of the top threats in global health. And we've seen that from WHO just last year. 2019. 2020 went really fast, didn't it? So patient engagement is very critical. And we know that it's multifactorial. It doesn't mean that people are anti-vaxxers, and it causes a lot of anxiety for pharmacists and patients. The idea that somebody is not necessarily getting vaccinated or wanting to get vaccinated doesn't necessarily mean that they don't want to have a vaccine. They may not want to be vaccinated at this time. There may be other reasons that they don't want to get a vaccine, not because they think that it's got toxins or poisons in it or that they're an anti-vaxxer. But pharmacists do find it very anxiety causing, and their own misconceptions or preconceptions about patients may also play into that. So it's very important that we can feel that we can discuss vaccine hesitancy with patients, but pharmacists feel concerned sometimes that they can't have that discussion. And if they're taking on the role in vaccination and they're going to step up to that, they feel they're going to be even further forward at the coalface of having those discussions, and it increases their anxiety about that. So it's really important that they feel confident about that, and that there's heaps of tools and resources available for people to do that, and to upskill in the area of vaccine hesitancy and the types of interactions they can have with patients around that. Next slide, please. The next part is around really technique-related issues. And again, I think it comes down to the first part around the fear of the interaction and the contact with patients. And technique is a really big part of that. And it is certainly, vaccination is something about confidence. The more you do, the better you get. Coming at somebody like this, where you're shaking at them or you're going to throw it at them from a distance, doesn't instill confidence in the patient or yourself. But technique-related issues and the risk of causing injury to patients is real. And pharmacists need to understand the importance of understanding the risks and the technique-related issues. And shoulder injury related to vaccine administration is real, and it is potentially a real problem. And there have been cases certainly related to pharmacists administered vaccines and other health professionals. But it is something that we do need to be aware of. And it comes down to understanding the role of needle size, the positioning, understanding what the complications are and what they look like, and the types of appropriate monitoring. And that's for all types of vaccinations, understanding the types of needle size, the types of needle that you need for different types of vaccinations. And we'll hear more from Maria around those things. But it's understanding the technique-related issues. And I think the fear of complications by nature of our personality is something that pharmacists are worried about if they do give vaccinations. And again, this is something that's come up from pharmacists who are vaccinating, the fear, particularly with patients, interestingly, that are slightly slimmer and have thinner arms and more wiry. They're more worried that they're going to cause a problem. But, you know, that's not always the case. You know, they need to understand the technique and the type of technique that they're going to use, the risks, where the areas are of concern, and what they can do to minimize those and what they need to watch for. Next slide, please. Coming back to our first point about appropriate training, I think the other concern that gets raised by some of our colleagues is that we can't manage a declining patient. So this comes down to the points about training and pharmacists not being able to manage somebody that's having anaphylaxis, or not being able to manage somebody that's having a vasovagal reaction, or somebody that's having some kind of bad reaction generally to a vaccine. So that plays on sometimes pharmacists' concern generally that what are they going to do if something goes wrong? How are they going to notice the difference between anaphylaxis or a vasovagal response, et cetera, et cetera. So training is very important, but also reinforcing to pharmacists that they can do this, that they can manage patients in their practice anyway, regardless of whether they are vaccinating or not. And that the risk of somebody coming in that's had a reaction to a peanut or a food that they've had wanting an EpiPen is probably, you know, higher than the risk of having a problem with a flu vaccination. So it's really important that we understand managing a declining patient and what is an emergency, what is a vasovagal response. And there will always be questions of our capacity as practitioners, and that's why the training is so important. And it isn't just about anaphylaxis, but understanding anaphylaxis is going to help us with our general practice as pharmacists. It's important for other medical events. It includes our training for CPR that we must have, and not pharmacists don't always have to have CPR training year on year in all jurisdictions in all countries. But if you are going to be a vaccinator, you need to have CPR training. It's very valuable to have anyway. Vasovagal reactions are something that happen with people having vaccinations, and it's important for pharmacists to understand that. And needing to be able to identify any kinds of issues with patients during vaccination. And we've had a number of incidences during our pilots when we were initially rolling them out, where pharmacists demonstrated that they could very appropriately identify not only a vasovagal reaction, but somebody who was actually having an epileptic fit while they were in the pharmacy, as opposed to somebody having anaphylaxis, as opposed to somebody having a vasovagal reaction, and appropriately managing those things. Not from the vaccination, that's not what was happening from their flu vax, but to appropriately manage somebody that was having a medical emergency in their pharmacy. So I think pharmacists get concerned about these things because that's the feedback. You look to implement this scope of practice into your jurisdiction or your country. These are the things that other practitioners will come back and say, you can't do this. But this is the concern that pharmacists have. They won't be able to manage it, but they can. They can manage these things, but they have to understand the things that they're looking for. Next slide, please. The next thing that's really important is understanding the vaccine. And pharmacists will get concerned about what to do when new vaccines are added to the schedule of vaccines that they're able to administer. In most jurisdictions within Australia and in other countries, we start with the flu vaccination. and it's fairly straightforward as an inactive vaccine. But then other vaccines will be added to the regimen. We might get live vaccinations, and now with COVID, we're getting mRNA vaccines. So we're getting much broader list of vaccinations that are getting added. And it's not a case of all vaccines being the same. And even with the flu, we're getting different types of vaccines. We're getting quadvalent. We're getting much stronger vaccines for older patients versus the standard vaccines that are being used for the general population. They are different vaccines for different groups. We've got pediatric vaccines, and we'll talk more about this with Maria. It's important to understand what vaccine you have for what people. And more recently in Australia, we've had some deaths attributed to Zostavax, for example, where the inclusion-exclusion criteria has probably not specifically been applied, not by pharmacists, but by some medical practitioners, that has meant that people have been given the vaccine who probably should have been excluded from using it, who were immunosuppressed. And again, it highlights some of the risks that we have with some of these vaccinations. And these are the things that pharmacists worry about. There's a whole list of exclusion criteria. Am I going to get the right vaccine for the right person? What's going to be the consequences if I get this wrong? What happens if they've got an allergy to this? What happens if they've got a pre-existing condition? What if they take methotrexate once a week? What if they had a dose of prednisone 3 weeks ago? Is that going to be a problem? So there's a lot of things to think about with vaccines and different vaccinations. You know, what should I monitor? What should I watch for? How should we be prepared to give this vaccine? Is it something that's pre-prepared? Do I need to reconstitute it? What do I reconstitute it with? What needle do I need to use? All of these things Maria will talk about. But also, what's the needle stick risk? How do I dispose of it? All of these things are really important. And I think most importantly and more importantly is recording the vaccine and the vaccine details. And in Australia, we have an immunisation register, which is electronic, allows us to record adult and children vaccinations nationally, which is it's gold. Now pharmacists can report to that as well. Means that we have an electronic record of people's vaccinations, but it's very important that we can record those details. So I think understanding the vaccine is important, and that causes anxiety. Flu seems quite straightforward, but as we start to increase the scope and add other things to our list, it starts to get more complicated. It becomes more important for us to really understand what we're adding to our regimen of vaccines. Next, thank you. And just a sort of a closing point, understanding COVID's on the front of many of our minds, and we've just had some news in Australia today that we will be delivering the vaccine through Community Pharmacy Network in Australia, which is exciting. We know that this is going to be one where we need to think about the fact that there are multiple vaccines, what we need to prepare it, multi-dose vials, how we're going to store it, what are the protocols, varying schedules, how we're going to record it, the importance of recall, how are people going to get back to where they need to get their next doses, and the fact that there's going to need to be very active pharmacovigilance attached to this group of vaccinations as they get rolled out in each of the countries. And I know in Australia we're benefiting from the rollout of the vaccines in Europe and North America, and we're getting that data coming through to Australia to help us with our registration process. So all of the things that we're kind of got as some of the concerns that are bubbling away in the back of the mind of pharmacists as they think about engaging in the vaccination process for COVID are playing out specifically in the space of the COVID vaccines rollout in our country. So I think the COVID space is exciting, but it also highlights many of the things that we just talked about. That might be my last slide. Oh, no. I think my last slide is it's coming. I think the opportunity for pharmacists is very exciting in vaccination broadly, but I think COVID has highlighted for us how important pharmacists being in the vaccination space has been. And I think as I've watched my colleagues internationally through social media and other forums, get into the space of the COVID rollout, not just in reconstitution, but in administration and involving technicians in that space. It's been exciting to watch, and I've never been prouder of the pharmacy profession and its engagement. So hats off from Australia to all of our colleagues through Europe, UK and North America. Congratulations, people. So just to finish off, I think what I've already highlighted is that we've got these skill sets around cold chain, immunity, vaccines, vac schedules, anaphylaxis and more, and that we've added through our training patient assessment, hand hygiene, declining patients and the different routes of administration. So I think that that's the really important bit that we need to highlight, where people have concerns and they have anxieties and questions about pharmacists and pharmacy being able to participate in vaccination. Next slide, please. So I think just in summary that, many of the concerns are driven by other people, and that pharmacy really gets a lot of its anxiety from things that other people direct towards us. And we have the capacity to work through many of those things through good training, through reinforcement of these kind of backgrounds and availability of good information and training within the profession. So go forth, vaccinate. Thank you.
Thank you, Lisa. Wonderful presentation and too much involvement from the participants. This is really good. Thank you for this presentation. We'll keep some questions for the end. We go now to our next speaker. Our next speaker is Maria Mendes. Maria Mendes is from Portugal. She's a pharmacist since 2011 at the Faculty of Pharmacy at the University of Coimbra, with experience in community pharmacy and hospital pharmacy. She is an area manager at the Center of Medicines Information and Health Interventions at the Portuguese National Association of Pharmacies since September 2019. Her areas of responsibility encompass all issues relevant to public health interventions in the community pharmacy, namely the development of new intervention methodologies and professional practice support tools, and the implementation of pharmaceutical intervention projects and pharmacy services support. Thank you, Maria, and the floor is yours.
Thank you very much, Maron, for the kind introduction. And thank you, hello everyone, and thank you very much for attending. I would like to congratulate FIP for the organization of these important sessions. Today, as you can see, I will talk about how to preventing common errors in vaccine administration. Next slide, please. This will be our agenda for today. Next slide, please. So, as you know, vaccination is one of the most successful, safest, and most cost-effective health interventions of all time. It is of paramount importance to increase the focus on vaccinations throughout the life course and ensure access to vaccines that are relevant for each age group, namely children, adolescents, adults, and of course, older persons. Improving vaccination coverage is a global imperative, and pharmacists, together with our colleagues in other health professions, must join efforts to ensure no one is left behind in vaccination strategies. Pharmacists have an essential public health role by acting as educators and advisors, facilitating and participating in national and global routine immunization strategies and practices, and delivering pharmacy-based vaccination. And all these rules have already been successfully implemented in many countries around the world, and Portugal is one example. We have the vaccination service in our pharmacy since 2008, and there is a wealth of evidence of the impact of pharmacists' vaccination-related rules. But the success of any individual vaccine relies on correct and widespread administration to the appropriate patient population, and vaccine errors threaten to undermine the protection immunization provides and often leave patients inadequately protected against serious diseases. Therefore, pharmacies should be knowledgeable and updated about appropriate techniques to prepare and care for patients when administering vaccines. Next slide, please. So immunizations need to be administered according to the 7 rights. Next slide, please. The first one is the right patient. Before administering any vaccine, the patient's immunization status should be reviewed and the patient should be screened for contraindications and precautions, even if the patient has previously received that vaccine, because the patient's health condition or recommendations regarding contraindications and precautions for vaccination may change from one visit to the next. And second, the right vaccine. We must always check the label on the vial or on the box to determine if it is the correct vaccine and diluent. If needed, some vaccines need to be reconstituted, as Lisa said. So a specific diluent will be provided by the manufacturer. So it is very important to follow manufacturer guidelines in reconstituting the vaccine, and also each vaccine and diluent should be carefully inspected for damage, particulate matter, or contamination before using. And we should always verify if the vaccine has been stored at proper temperature. Next slide, please. So the right vaccine should be administered to the right patient in the right time. And this includes administering at the correct age, at the appropriate interval, and with the appropriate interval, and before vaccine or diluent expires. So we should check the schedule to ensure the patient is getting the vaccine at the right time and the appropriate interval. And each vaccine vial should be checked for the expiration date. Expired vaccines or diluents should never be used. And once reconstituted, the vaccine must be administered according to the guidelines or discarded. In most of cases, if not used within 30 minutes, the vaccine will lose its potency and the patient will not be properly immunized. And prior to dispensing or administering a vaccine, we should always verify if the dosage is the correct and pay attention to age-specific formulations of vaccines. And also, when drawing from multi-dose vials, that it's not very common in pharmacy anyway, but vaccine administrators need to make sure they draw the correct amount of immunization. Next slide, please. Well, as you know, vaccines are administered through 5 routes: intramuscular, subcutaneous, oral, nasal, and intradermal. Well, intramuscular and subcutaneous are the most common routes. So we have to choose the correct supplies to administer vaccines by injection, and I mean, select the right syringe size, needle length, and the location that should be used. And because vaccines must reach the desired tissue to provide an optimal immune response and reduce the likelihood of injection site reactions. In administering intramuscular injection, it is important to use a needle with the correct length to reach the muscle mass and not seep into the subcutaneous tissue. And the needle should be inserted at a 90 degrees angle and quickly. Subcutaneous injections are administered at a 45 degrees angle, and the subcutaneous tissue is pinched up to prevent injection into the muscle. Next slide, please. The vaccines should be administered in the right sites. Note that adults and children of different sizes and ages will need vaccines administered in different locations on the body. And if you have to give more than one vaccine, you should use separate anatomic sites for each injection. And last but not least, accurate and timely documentation can help prevent administration errors and curtail the number and cost of excess vaccine doses. And in addition, preventing excess doses of vaccines may decrease the number of adverse reactions. Next slide, please. So, focusing now on the vaccine administration errors, well, the World Health Organization emphasized that adverse events due to vaccine errors are most common than adverse events due to vaccines themselves. Errors in vaccine administration are common, but relatively little data are available on why they happened. And improper vaccination may have negative effects on individual and public health, leading to disease outbreaks, loss of herd immunity that may propagate an epidemic, costly over-vaccination and revaccination, and consumer skepticism or refusal of vaccination. So it is very important when a vaccine administration error occurs, pharmacists should determine how it happened and put strategies in place to prevent it in the future. Here you can see a list of the most common reported errors in vaccine administration. We will analyze each one of these errors, ways to mitigate them, and what to do if they occur. Next slide, please. One of the most common errors is administering a vaccine to a patient with a contraindication. Most of the times because the professional didn't use a screening checklist to identify patients' contraindications and precautions to vaccination. So in order to avoid this error, all patients should be screened for contraindications and precautions every time a vaccine is administered, as I told before, even if the patient has previously received a dose of that vaccine, because the patient status can change from one visit to the next, or a new contraindication or precaution may have been added. So you must always use a reliable screening questionnaire to consistently and systematically avoid either, first, giving a vaccine to a patient for whom it is contraindicated. It could be a very serious situation, potentially life-threatening. And second, missing opportunities to vaccinate because of false contraindications, which can also be life-threatening as they can leave the patient exposed to a vaccine-preventable disease. Next slide, please. You can use Immunization Action Coalition screening checklists that are available at immunize.org. And you have also the CDC's vaccine contraindications and precautions webpage. Next slide, please. Just as an example, in Portuguese community pharmacies, we have an IT tool called Cifarma Clínico that helps the pharmacists to check for contraindications and precautions before flu immunization. Next slide. Another group of commonly reported vaccine error contributing factors included similar brands and generic names, abbreviations, and vaccine container labels or packaging. To avoid this kind of error, you must store vaccines with similar packaging or names on different refrigerator or fridge shelves to lessen the risk of errors. And you should prohibit the use of coined or informal names for vaccines. And if vaccines abbreviations are permitted, allow only current, standard, and official approved abbreviations. And another important measure to prevent the administration of the wrong vaccine is to prepare vaccines needed for one patient at a time. And if this error occurs, the patient should be told the wrong vaccine was given, and you must provide the correct vaccine with correct spacing if necessary. And it is very important to access how this error happened and ensure it will not happen again. Next slide, please. Another error that is frequently reported is to give the wrong dosage amount for the patient's age. And this error is usually related to mistakes in choosing age-specific formulations of vaccines intended to prevent the same diseases. Thus, prior to dispensing or administering a vaccine, verify the patient's age by asking the birthday, and also compare the patient's current age with the product or the vaccine information. It is a good practice to store vaccines with pediatric and adult dosage in different shelves and clearly marked as pediatric or adult. And also administering the wrong dosage may also occur when the liquid spills or leaks out as a vaccine is being administered, or when the vaccine is drawn from a multi-dose vial. Next slide, please. When vaccines are administered to patients at a less than the recommended dose, the vaccine will usually need to be repeated. And the dose the patient receives, because the dose the patient receives may not be sufficient to evoke a full immune response. So the vaccine should ideally be repeated on the same day or as soon as possible thereafter. Vaccines administered to patients that are greater than the recommended dose will not usually affect the overall immune response or protection afforded by the vaccine, as an individual cannot have an overdose of a vaccine. However, this may lead to an increased risk of an adverse reaction, and the patient should be monitored and should receive the subsequent doses in the series on schedule. This doesn't change anything. Next slide, please. As already told, some vaccines require reconstitution with the diluent or with other vaccines prior to administration, and are supplied with the diluent or vaccine that should be used. It happens that sometimes by mistake, you could use diluents without vaccines, and or one component of two components vaccines, or use the wrong vaccine diluent. There is little data on the effect of using a diluent other than that license to be mixed with the vaccine, but it could affect the potency of the vaccine, and the patient might not get the full benefit of the vaccine. Some vaccines diluents, as you know, contain stabilizing agents, bactericides, chemicals, or buffers specific to the vaccine they reconstitute. And as a result, using the wrong diluent could potentially affect the potency or even destroy the vaccine. So to avoid this error, use careful labeling in your vaccine storage unit and keep the vaccines and their diluents together if the storage requirements are the same. check the vial and diluent labels before reconstituting the vaccine. It's not very common to administering the diluent only, just in some vaccines that include antigen in their liquid component. Next slide, please. Well, if the wrong diluent is used, the vaccines need to be repeated, with some exceptions, of course. Well, if an inactivated vaccine is reconstituted with the wrong diluent and is administered, the dose is invalid and should be repeated as soon as possible. But if a live vaccine is reconstituted with the wrong diluent and is administered, the dose is invalid if it can't be repeated on the same day. It needs to be repeated no earlier than 4 weeks after the invalid dose. This is very important. The spacing is due to the effects of generating a partial immune response that could suppress the live replication of subsequent doses, even of the same live virus vaccine. Next slide, please. All vaccines have an expiry date that is determined by the manufacturer and is clearly documented on the vaccine packaging. If a vaccine is even 1 day over its expiration date, it should not be used. In order to mitigate such error, you should rotate stock in your storage unit, which means make sure your vaccine that expires soonest is the closest to the front and easiest to reach. And it is important to establish a regular schedule for checking your storage units for expired vaccines. If a dose of expired vaccine is given, it should be repeated. It's not valid. If the expired dose is a live vaccine, you must wait at least 4 weeks after the expired dose was given before repeating it. If the error is detected in the same day, a repeat dose can be administered that day. But the repeat dose of an expired inactivated vaccine can be given on the same day or any other time. Next slide, please. Well, it could also happen that you give 2 doses of live vaccines too close together. To avoid this situation, you must ask the patient if they have received any recent vaccination. You could address the question, have you or has your child received any vaccination in the past 4 weeks? This is actually a question from the screening checklist for contraindications and precautions. And you, if available, you can check also the person's vaccination record. Well, if 2 live injectable or nasally administered vaccines are administered less than 4 weeks apart and not on the same day, the vaccine given on the second should be considered invalid and be repeated. The repeat dose should be administered at least 4 weeks after the invalid dose. Note that oral vaccines can be administered simultaneously or at any interval before or after other live vaccines, if indicated. You have, for example, the typhoid vaccine, rotavirus, and cholera vaccine. Next slide, please. Well, recommendations for the age at which vaccine should be administered are informed by the ability to respond to the vaccine, the age-specific risk for a disease, the risk of disease complication, and of course the likelihood of achieving a high coverage. If administered sooner than the recommended age, vaccines will generally not be harmful, but may not evoke a good immune response or provide the desired long-term protection. And similarly, vaccines given sooner than the recommended interval from the last dose may lead to a reduced immune response. So all pharmacists and all vaccine administrators must know the recommending age and minimal intervals for all vaccine series. And of course, you don't have to memorize it, just keep an easy to read immunization schedule. And if for staff, for example, you have the CDC table of minimal intervals, as you can see in the image. And of course, you can also check with your country immunization program. Next slide, please. And what should we do after such an error? So a dose administered 5 or more days earlier than the recommended minimal interval between doses, it's not valid and should be repeated. The repeat dose should be spaced after the invalid dose by the recommended minimal interval. Similarly, doses administered 5 or more days before the minimal age should be repeated on or after the patient reaches the minimal age. If the vaccine is a live vaccine, you already know waiting at least 28 days, 4 weeks from the invalid dose is highly recommended. If the vaccine is given later than the recommended interval from the last dose, as a rule, there should be no requirement to restart a vaccination course. Actually, responses to booster vaccinations are usually higher when there is a longer interval from primary immunization. So protection after the completed course is expected to be equivalent to the recommended schedule. The concern here is when vaccines have been delayed behind the recommended interval because in that period, patient is unprotected and could have could be at risk of infection between doses. We have some exceptions, specifically the rotavirus vaccine, because the first dose should not be given to babies older than 15 weeks of age, and the second dose should not be given if the child is over 24 weeks of age. Oral cholera vaccine, the primary course of the immunization must be restarted if more than 6 weeks have elapsed between the first and the second doses, or if more than 2 years have elapsed since the last vaccination. Next slide, please. Sometimes it could also happen to administering a vaccine in the wrong site or by the wrong route. And to prevent it, you should always check this information in the package and in the vaccine instructions. And in your practice, you can prepare your vaccination area, post reference materials that show you the site and the routes for each vaccine for each group. You should also highlight or otherwise mark the route information on the package. Next slide, please. The deltoid muscle is the preferred one for intramuscular injection for children aged 3 years and older and adults. And the anterolateral site is the site of choice for infants and toddlers under 3 years old. Although the gluteus muscle is not a recommended site for vaccination, in general, a dose given there can be considered valid. The exceptions to this general rule are hepatitis B, rabies, and HPV vaccine, which should not be considered valid if administered in any site other than the deltoid or anterolateral site. Although vaccines should always be given by the route recommended by the manufacturer, if a vaccine is given by the wrong route, For example, subcutaneously instead of intramuscular, or intramuscular instead of subcutaneous. It doesn't need to be repeated, with the following four exceptions: hepatitis B, rabies, HPV, and inactivated influenza vaccine that is labeled for intramuscular administration, and they should be repeated. Next slide, please. We are almost done with vaccination errors. The last one of the list is administering improperly stored vaccine. Exposing vaccines to any temperature outside the manufacturer's recommended range is considered a breach of the cold chain and may invalidate the product license. It is, however, the length of time spent outside of the recommended cold chain conditions and the temperatures to which the vaccines were exposed that may compromise the potency of a vaccine, and as such, will determine the significance of the breach. So you must, when something like that happens, you should always contact the manufacturer. Next slide, please. So I will finish my presentation leaving you with some vaccine administration tips. Next slide, please. So you should always follow all vaccine administration policies and procedures. Don't forget to access patient vaccination status and determining needed vaccines, as well as screen for contraindications and precautions. Don't forget, this is very important. Prepare and administer vaccines properly, follow manufacturer instructions and all the procedures. And routine infection control procedures must be followed. This is very important, and you have to be you have to have care for hand hygiene, wearing gloves, follow strict aseptic medication preparation practice, and don't forget to document all the procedures. Pharmacies should be prepared to inform patients, as Lisa told before, and we have to be prepared to respond to questions or concerns about vaccination and about comfort and care strategies after vaccination, including how to deal with common side effects such as injection site pain or fever. And instructions should also provide information about when to seek medical attention. Next slide, please. As a conclusion, well, international rates of vaccination error reporting remain low, with few reports of significant adverse reactions. Vaccination programs should consider the impact of vaccination errors on individual and population health. Continue with monitoring and promotion of error reporting will enable further understanding of these topics. So, as take-home messages, establish an environment in your pharmacy that values the reporting and investigation of errors as part of risk management and quality improvement. Pharmacies should be encouraged to report errors and trust that the situation and those involved will be treated fairly without fear or punishment. Error reporting provides opportunities to discover how the errors occur and to share ideas to prevent or reduce those errors in the future. So the lessons learned from the incident should be shared and used to improve future practice and avoid recurrence. Next slide. And next slide. Thank you very much for your attention.
Thank you, Maria, for this valuable presentation. We would like to tell everyone now that we will be visualizing two videos. These are educational videos for healthcare professionals. The first one is about the pre-vaccination procedures, and the second one is about the route of administration. So please take time while watching these videos to ask your questions if you have other questions to be asked, whether be it on the chat or on the Q&A box. We have been answering most of your questions on the chat box or in the Q&A section, but you are most welcome to ask us more questions, and we will be going back to question and answers at the end of this webinar after the videos. Thank you. Okay, So we'll go now to the question and answers part, and we do have like many questions to be asked to our presenters. I will start with Lisa. Lisa, we have a question about the older people that have a decline in their immune response. Is there any age after which it does not make sense to administer vaccine for these patients as they cannot develop any more immunity?
Great question. I think it would depend on the individual vaccinations. I think what we've seen with flu-vax is, or flu-vax as a generic term, but flu vaccination is that they've brought out a more specific version of the flu vaccination to give a higher boost to the immune response to older patients because of the sentience in their immune response to try and boost their capacity. It's obviously acknowledged that the immune response can be lower in older patients, and that is a concern. But I think because it's often considered that there's a risk benefit in the potential disease states for various groups, that's often what some of our clinical colleagues weigh up in those considerations. But I think what we've seen in some of the other vaccinations, like I guess zoster is a good example, is that sometimes where it's funded by government groups for particular age groups, it's only funded to certain ages because I guess the risk benefit equation starts to decline after certain ages. And so they don't see a return on investment by funding it over, say, 75. So after you're 75, they don't sort of fund it. So you're right, because of the sort of declining immune response, there isn't enough data to suggest that maybe giving extra doses is of benefit for particular vaccines. And so they sort of don't necessarily see a return on investment sometimes. But flu is one where we've seen particular companies invest in increased doses so that we can boost the response in older people, because we know that the mortality can be so high. But that's a great question. Yeah.
Thank you, Lisa. Maria, we got a question about if a patient has hemophilia, how to manage and predict this condition in patient while we are on massive vaccination. So when things should be like very fast, we have to vaccinate a big number of people. So do you have tips for us in order to like how to manage these conditions while vaccinating?
I think you mean, I didn't hear properly. You mean hemophilia?
Yeah.
Yeah. Well, we don't vaccinate in pharmacy these kind of patients. So I don't have many tips for this. It's an exclusion criteria for vaccinating in the pharmacy.
Yeah, so here maybe the important thing is going back, as you said, to the history of the patient, to what we have documented about the patient in order to screening, as you said in your presentation. So the importance of having everything documented
it is very
for
important.
The patient.
And if you use a checklist, it is much more easier. You can have checklists for each vaccine, each age group. You have many of these checklists on the CDC's website. You can go there. They are very useful tools, because it's very difficult to memorize all the contraindications and precautions. They are quite different. So this is my tip. It is very useful to use reliable checklists and questionnaires.
Is there anything to add?
Yeah, I was just going to say, often, where you've got almost like a clinic situation, or you've got lots of patients coming in, and sometimes that happens in the flu season, you get a lot more sort of experience, or pharmacists have had a lot of experience with flu vaccination, where you're having a lot of patients coming in, having them sort of pre-check those checklists before they come to the pharmacist to sit down and run through those questions with them. It gives them a chance to fill those checklists out and identify any of those things, even if they put, you know, stars and question marks and circles and whatever around something they're not sure about. At least it highlights that, you know, like allergy is always one. You know, I'm not allergic to eggs, but, you know, I'm allergic to dust mites or whatever. But at least it's a conversation starter, or it gives them something to do before while they're waiting. But, you know, I think those checklists are a great idea. And as you said, Maria, for individual vaccines where there may be precautions or things that you need to watch for, it's a brilliant idea.
Thank you. We have many questions coming from pharmacy students or fresh graduates. They are asking about what they can do now in order to help. So Maria, as a faculty member, what is your advice for these students, these future pharmacists?
Well, I work at the National Association of Pharmacies in Portugal. Well, I don't know. In Portugal, the students started their practice in the last year, and they can contact with these kinds of services. But in Portugal, you have to attend a specific training after graduate. So I don't have any selection for the students, but they can learn about they can study the vaccines and get familiarized with them. So I think that's what they can do, I guess.
Isa, anything to add?
I would say, you know, to get on the back of that is get involved with the student association, get involved with the national associations. You know, if you're really keen, advocacy is the great thing to do, and that will keep you engaged in what's happening, you know, within your jurisdiction, your state, or your country. And I think there's a good example that we've seen in Australia. The National Student Association's been lobbying the government to ensure that pharmacy's been involved or will be involved in the COVID rollout, and that will give them an opportunity as students who will have trained to do vaccination to be involved at some point. So I think, you know, you can never miss an opportunity to have a voice, and I think it's a really good time to advocate for the young pharmacist group in FIP and other national organisations at universities as well.
Yeah. We have many questions about the space for vaccination in the pharmacy and the community pharmacy, how the space is managed, if there are guidelines for it, how it differs from a country to other, and of course for the cleaning process of this space between patients. Can you give us an idea about this and where we can have the information about it?
Well, in Portugal, the physical requirements are described in the decree law. So we have to fulfill physical requirements, but also technical requirements, and all of these are described in this decree law. So in Portugal, we have to follow all these requirements.
Yeah, I mean, ours is fairly similar. I think most places have a practice standard of some kind related to immunisation or vaccination standards, either nationally or for pharmacy. Some of the states have more specific requirements. So in Australia, because we're split into states and everybody likes to be different. For example, in some states, you have to have a sink in the room, whereas in Queensland, you don't. You basically have to be able to lie a patient down. If they're a declining patient, you need to lie them down, but you don't specifically have to have a bed in the room. You just have to be able to have a clinical space where you can have a private consultation. So somebody could take their shirt off, because you obviously have to administer in somebody's arm, and that might involve them taking their shirt off. So it just has to be a private area in most places. The cleaning is an interesting question. Now it's COVID time, and that came up for us more recently when we were talking about COVID testing in the pharmacy, before we even started talking about COVID vaccination, and what would happen to any other clinical service if you did COVID testing in your clinical room, and then you had to clean everything down and then had to start again. And I think, you know, there's protocols in place for COVID cleaning and what you would have to do, but that would assume that you had infectious patients who are coming in for testing. So I think it would be standard procedures for all of those, but there are generally standards available for the rooms.
And my last question for you both is how to start advocating. So we have many questions in the chat box or in the Q&A talking about how shall we start advocating for pharmacist vaccination in our country. So what is your tip for these pharmacists that are willing and motivated to start this process and to approach the regulators?
Well,
You go, Maria.
well, you have a lot of evidence now. So I think you can use that evidence and that experience from other countries to try to talk to the regulators and show that.
Lisa?
Yep. I would echo the evidence. I think we did that. We used evidence from other countries. Don't reinvent the wheel. But I think if you understand the types of things that people will come at you with, like we talked about, I guess, in my presentation, that you won't be able to do it, that people will die in the street, that you're not competent, that you can't touch people, that you don't know how to do injections. If you understand all of that, I think, you know, just put that to the side, use the evidence of hundreds and thousands and millions of vaccines that have been given by other people for decades. Find the advocate in the department, in the health department or the ministry or whatever you've got, and the burning platform. So if the burning platform is that you've only got 20% herd immunity or vaccination rates for your major flu seasons, use that as your burning platform and say, pharmacy, you know, minister, pharmacy can get that rate up for you. And that's what we were able to do. We had a chief health officer that wanted to increase the immunization rates for flu because we'd had some very bad flu seasons. And she understood that community pharmacy was going to improve access and they were going to be able to help her to meet her target, which was very ambitious, but we were going to be able to do that. So you got to find an advocate that's going to bat for you. And the rest will happen because there's plenty of data. And FIP's got a great report. FIP's got a great report.
Yeah, exactly. Thank you, Lisa and Maria, for the presentations, for the answers. And before leaving the floor to Gonzalo Sosa Pinto, who is the program lead for the series, I would like to thank all the participants and their engagement in this webinar, and thank FIP for the opportunity for us to convey our messages to the pharmacists all over the world. We can do the work, especially now that there is a need for people to vaccinate. So take the opportunity, advocate, look at the success stories all over the world, and be prepared, because it's not just about giving the vaccine or the shot. It's about having the full knowledge from before, during the vaccine, and after the vaccination. So it's a whole process, like the other process when we do with other diseases. Thank you, everyone. Gonzalo, the floor is yours.
Thank you, Marwan, and hello, everyone. Just a few words as we come to the end of this series. We started this series in July and have covered a number of issues related from flu vaccination in the times of COVID-19, from advocacy. We had many questions today about how to achieve pharmacists' right to vaccinate at country level, and how to achieve a level of competence and confidence by pharmacists to deliver this important service. And we have covered that in various webinars as well. We have covered webinars on vaccine safety and confidence. There have also been several questions today about how to ensure that vaccines are safe. And just a few months ago, we had a webinar focusing precisely on how safety is built into the process of developing and manufacturing vaccines. But there's a lot of work that pharmacists can do in building confidence in vaccines among people and addressing vaccine hesitancy and concerns. So we have managed to cover a range of issues. Also, the social value of vaccines, or the value of vaccines for specific population groups. For example, we have also presented the findings from a global survey conducted by FIP on the role of pharmacists in vaccination, that is available on our website, and I invite you to visit that as well. So we have covered all these different topics across these different 10 webinars from July until today. And also in parallel, as Marwan mentioned at the beginning, the other series that we also focused on called Transforming Vaccination Globally and Regionally. So I would like to thank you all for attending today's webinar, and our speakers today as well, Lisa and Maria and Marwan, for moderating this event. And I would like to thank once again to our sponsor, GSK Vaccines, for supporting us in delivering a sub-series of 3 webinars, including today's webinar, that were highly attended and really had a lot of interest among our profession. So stay tuned. Check the recordings of all these webinars are available on the FIP YouTube channel, so you can revisit and rewatch the webinar as many times as you wish, and share it with your colleagues, with your students. So thank you very much for that as well. And stay tuned for further developments on COVID vaccination by pharmacists. We will be out there supporting healthcare teams and societies in achieving high vaccination rates for COVID-19, as well as all other conditions that can be prevented by a vaccine. So again, thank you very much and have a good day or evening. Bye-bye.
Bye.